tuned to Planet Vero Radio. I am Cindy Schwartz. We are broadcast on iHeartMedia, and we are also podcast on Spreaker. This is the Patient Partner Show, and I've got my co-host Jeannie Roller with me on Skype. She's in Indiana. Jeannie, today we're talking about some court cases and some information about why do opposite-sex medical personnel just routinely be involved with the opposite sex person for different procedures, urological procedures, GYN, OB procedures, and the patient has seemingly no say about it. That's what a lot of these big hospitals say. You know, we have them on staff, and it's against their civil rights for you not to allow them to work on you. But yet, as the patient, we have civil rights, too. I mean, we talk about that all the time. I mean, our rights are being obliterated. We've talked about that. Our informed consent is really not really informed. We have to conform to their informed consent and their patient rights. And so let's talk about that, because we have instances, and you brought it to my attention, you know, again, that prisoners have more rights seemingly than medical patients, and so do, you know, we've got TSA workers. When they pat people down in the airports, they use a female person to pat down a female passenger, and vice versa, a male TSA agent and a male passenger. But yet that doesn't work in the medical community, because they tell us that you're abusing these people's civil rights. And I want to add, too, that a lot of the personnel that are being involved in some of these intimate procedures, they're not registered, they're not licensed, they're not certified. These surgery techs nationwide don't have any certification. Yeah, some states are getting into it, but it's not a requirement. There's no license for these people. This is a person that has filled out an application in a hospital, and they deem him or her okay to work on naked patients and intimate procedures. So I throw it to you, Jeannie. What are your thoughts?
Well, my thoughts are the same as yours. I mean, it's wrong. There should be same gender care options for especially intimate procedures, and or if the patient is unconscious. There should be no question.
Right. And then there never seemed to used to be that way. And someone explained it to me the other day when I was having a conversation with them. And they said, well, you know, nowadays, you know, it costs too much money maybe to have, well, you know, a male on staff, a female on staff. And, you know, there's a lot of bother to it. And I'm like, I stood there with my mouth gaping open going, what? This was normal operating procedure, literally and figuratively, all along. And then it changed. And so I never got that memo that it changed, and I'm being a little bit facetious, but why do we have to even fight against this? I mean, why aren't we just given our civil rights and our human rights and be treated like everyone else?
Well, because the medical community itself is the one who spreads this lie that gender doesn't matter, that they have seen everything that you've had and it doesn't matter. They are professionals. Your sexual organs don't do anything for them, but apparently it does, because we have reports in newspaper and court cases of doctors and nurses who sexually assault patients. So apparently that is not true.
Well, right, I'm with you. I don't think that it is true. I think more and more of this stuff, and we see it, like you say, in the news, certainly now, is coming out that it does matter, that these are supposed, you know, trained, highly trained medical people, and they're some of the ones that are doing this, and also the ones that are not as trained. A lot of that gets kind of slipped out the back door, if you will, because people don't know, because you're drugged up.
Well, yeah, and when you consider that anywhere between 90 and 95% of every hospital staff is female, you have to wonder why in labor delivery cases that a patient is stuck with having a male team member.
For intimate examinations and for intimate care.
Because the hospital staff is overwhelmingly female. So what is up with that? Wouldn't that male staff member be better suited for for duty in a male gender-based area?
Well, that's when we get back to, and I've talked with several doctors about that. Some of them don't want their name public about it, and I get that because there's all kinds of legal ramifications, and that's what we always are barraged with. They say there's really no reason for any male to be involved in OBGYN. OBGYN, the doctors are, but that woman has selected that doctor. For the most part, unless it's an emergency, and of course that stuff goes out the window, but for the most part, she's selected the doctor that she has, or the doctor is there on staff and they know about it. The person most of the time knows about it. I mean, there's no 100% in anything, but the nurses are just sprung on you.
Right.
You don't know who they are.
Even when I had to have an emergency C-section and my regular female OB-GYN wasn't available yet, they asked my permission for the male doctor to do the initial exam while waiting for my female doctor to arrive. They asked permission, and that is how it should be.
Right. Because you should have the right to say who is going to enter your body, view your body,
right,
do anything to your body, because, like I said, the prisoners have that right, and so do passengers on airlines, but apparently medical people do not. And one of the cases that I have up here in front of me is titled Iowa Department of Social Services versus Iowa Merit Employment Department, and it's from 1977. And it says right in here, in this area of the law, the courts focus not on the employee's competence, so that would be the male tech or the female tech, vice versa, but rather on the obvious bodily intrusions which will result. The fact that the plaintiff is a healthcare professional does not eliminate the fact that he or she is unselected individual who's intruding on the patient's right to privacy. And it goes on to say, the male nurse's situation is not analogous to that of the male doctor or female, vice versa, who has been selected by the patient up front. That's what we're talking about. So why are these rights just being obliterated in the whole scheme of things? And no offense to male nurses or female nurses. I mean, those guys do a fabulous job. But at the end of the day, I don't want a male nurse giving me intimate procedures. I don't. And
right.
And I know that we've talked about your husband with female. Exactly.
Right. Yeah. Exactly. I mean, he will not seek hospital care because he does not want to be assaulted again.
Right. So where are the patient right advocates to talk about this?
Well, many of them won't.
Right. They don't. And the same as lawyers. I've contacted, I lost count how many lawyers that I've contacted to say, can we talk about this? Because that's what we want to do. We want to talk about it. One of the things that I found, too, is, and this came from an RN, she's up in Virginia, that there was just too many people in the medical system, and probably still are, that there's just not enough help to go around. So they use who they can, use who they have to.
Yes and no. I mean, the hospital that my husband had the issues with, there were male nurses there. And, they should have been utilized for him in the first place. No patient should be left alone while they are sedated with a member of the opposite sex. That is a recipe for trouble, because there is no way to guarantee that that person rendering the care doesn't have some sort of mental illness where they will abuse a patient.
Well, it's just the time, right? You're right. Yeah, to a certain extent, it's just the times that we've just heard and seen it so often that it's tough to trust this. And who wants to have this conversation? But I mean, wouldn't you rather err on the side of caution, right, than to open this kind of quagmire? And so I'm going to leave it at that, because we're going to talk about it more. And I'm going to say thank you for listening to Patient Partners. And please stay tuned to Planet Vero Radio.